Good afternoon, everyone. My name is Charles Castiglia. I'm president of Lakeside Memorial Funeral Home. I'm also president of the International Order of the Golden Rule. I've asked to be the moderator today, which isn't very much because I'm just going to introduce my friends here. There's four of us here today to present you on the 50-state view of the opioid epidemic. It's something that's in some areas very heavily and gaining traction in other areas, and it's a critical response. As you saw, the President named it an emergency situation for the United States. So we're here to help you understand the problem and then maybe help you with some ideas of what you could do in your communities. On the panel today, we have Dr. Stephen Bentsen he's the Regional Chief Medical Officer for Beacon Health. We have Dr. Philip Perez, leadership team for Wisconsin Heroin Task Force, and he has a very personal story that he's going to share with you as well. We have Keith Walker from Walker Funeral Homes in Ohio, and I'm obviously here, Charles Castiglia from Lakeside Memorial Funeral Home. So we'll start with Dr. Bentsen, who will go up to the podium, and thank you for being here.
Oh, thanks. Thanks so much. Can you hear me okay? Okay. Yes or no? I didn't hear. Yes? Okay, good. Well, it's a pleasure being here. These talks need to occur, but I always have mixed feelings about presenting them because right now we're in the midst of one of the worst epidemics in this country, and the deaths from opiates now are really getting to the point where they're exceeding the deaths that occurred from the HIV epidemic 10, 20 years ago. And unfortunately, over the past couple of years, we really have not seen any real decrease in the overall mortality with opiate use. And what we're hoping for from a healthcare standpoint is starting to really see a decrease in the exponential graphs of death that are occurring in this country. And I know you're the definition of the crisis. For me, being asked to be here really shows to me that this really is a crisis in this country. I am the Chief Medical Officer for a federal employer in Beacon Health Options, and we treat members with behavioral health conditions, including members with opiate use conditions. We cover over 40 million lives in the United States, cover 18 million lives with employee assistance programs, and we deliver the employee assistance program for NFDA. What I'm really going to try to do very briefly is kind of give you an overview of the heroin use and the rise of sort of how we got here. I think that was one of the questions that was posed to me. Kind of, you're seeing sort of the real tragedy at the end, but the question is, what I hear from your organization is, how did we get to this point? So I'm also going to try to describe some historical trends that I think kind of parallel kind of what has happened to us right now. And then to kind of briefly review what we see as treatment strategies and also review your employee assistance program as a resource. The real focus now with the opiate use problem in this country is the focus on heroin or synthetic opioids. And I think it's important to look at the history of heroin use in this country. It was the use of morphine as an analgesic really occurred during the Civil War, and out of that, morphine became, after the war, became used very indiscriminately across society. It was not regulated, not controlled. And heroin was actually introduced as a way to kind of decrease the use of morphine, because morphine was becoming problematic. And the thought was that if you had an injectable opiate, that actually the ability to use it would be much less, because people would not want to take an injection. And it was branded initially a safe and non-addictive alternative to morphine. And during this time, we had very open policy to obtain drugs like morphine, cocaine, and heroin. In the Sears Roebuck catalog, you could actually order cocaine in a syringe for $1.50 around the turn of the century. And by 1925, we had over 200,000 heroin addicts in the U.S. At that time, we had the introduction of the Harrison Act, which made the use of heroin in this country only for medical treatment. And so it kind of reined in kind of the overuse of heroin and opiates. And actually physicians were arrested for prescribing opiates to heroin addicts, because at that time, the drug use condition was not deemed an illness. And heroin use was criminalized, people were locked up, and the real way that heroin was extinguished from our population was really through incarceration and not treatment. And I think it's important to look at that because if you look at this slide here in the 1990s versus 1900s, you have kind of very similar kind of things going on. You had marketing of opiates to consumers, you had kind of culturally it was accepted. You see a young woman giving an opiate to a child to soothe them if they're crying. And then you see in our culture in the 90s, because this opiate problem did not happen in the past 10 years. This really started, I believe, in the 90s when we saw the pain scale. I don't know if you've seen that. That's actually from a medical record. Medical records in the 90s there was a movement to really quantify pain in the medical record. Pain was considered undertreated, and the goal was to have a person with a smiling face. And also we saw in society an acceptance of the use of heroin as was shown in magazines. The glamorization of the heroin look, the heroin chic, was very popular at that time. So we actually saw kind of an acceptance within society for the first time in a number of years of the use of opiates. So, you know, I look at the foundations of how we got here as kind of looking at government regulatory standards, the push of opiates as being safe, non-addictive, and pain as being undertreated in this country. These regulations and the push for the fifth vital sign of pain kind of pushed the use of opiates and pain and further fueled kind of the medication within the medical community. Because you have to realize before this, there was the hospice movement. The hospice movement really showed the first reintroduction of opiates into medicine. And that occurred in the late 80s, early 90s. Before then, you might recall this, people with cancer died in severe pain. People judiciously used opiates, did not use opiates to treat pain. So you really had kind of this introduction through the pain, through hospice care, and then through the treatment of chronic pain as being under-recognized but safe. And you saw doctors also being managed by how efficiently they treated pain, how satisfied were patients with pain relief. So this further kind of pushed the use of opiates. And we had an undesired effect of pain mills popping up to capitalize also on the economic opportunity of supplying pills to people who developed addictions from pain medicines. And the other thing that was missed was the comorbidity of mental health disorders. We know now that it looks like if you have any diagnosis in the past of anxiety, depression, or mental health condition, you have 4 to 5 times the risk of developing an opiate use condition. And this was something that was not recognized during this time. You also had marketing within the pharmacy community for the use of opiates. In 1996, believe it or not, there were 20,000 pain-related educational programs in the U.S. targeted for physicians to encourage them to prescribe pain medications for the use of opiates. And physicians that didn't prescribe were actually, there's evidence in the literature they were called opiophobic. They were phobic of opiates. So you had a whole shift kind of happening within the medical community, unfortunately, of kind of pushing along the prescription use of opiates. And in society, we saw kind of in the 70s widespread use of marijuana, LSD, and drugs, and there's a culture of drug use that also occurred in this country with the synthetic designer drugs and the acceptance of kind of a drug lifestyle with celebrities and famous people. And so here you see kind of a profound graph that compares the sort of a amount of opiate per capita in the US, which is the top graph, to Europe, which starts and you see the peak starts at the late 80s and goes up to where we are now. So you can see where kind of all this kind of led us. And you can see at the peak, we're going down. So actually the opiate prescription initiatives are actually working in this country. The number of prescriptions going out for opiates is actually decreasing, as you can see from the top. So it looks like we're changing the prescriber behavior. It looks like it is kind of trending downwards. However, what we're seeing is still continued increased mortality. And here I'm showing you a graph of the country. The darker colored states are actually states that have a much higher mortality versus the lighter colored states. The mortality rate has increased significantly in this country, even in spite of the decrease in prescriptions. And that is what's kind of very, very worrisome as far as within the healthcare field. And what we're seeing too, and this is being supported by recent literature, is that there's something else going on too. It's not just prescriptions, it's not just opiates, but it seems like there is a social determinant that kind of drives people to develop dependence or on opiates. Studies have shown how social losses, wages, and decreased ties with others are actually drivers of future opiate dependence and use. And you see in a number of these states kind of the low social capital in those states with lack of employment, poverty, and lack of social connectedness also are predisposing populations to developing opiate dependence. So those are issues too that I think going forward we're going to have to address to really stem this epidemic. And you can see since 2002 we've had a 300% increase in opiate-related deaths. And we have almost 100 people a day dying now for an opiate overdose. The interesting thing is that the prescriber of the opiate is usually not the abuser. About 75% of people that take prescriptions or end up with opiate use problem are using somebody else's prescription. So the prescriptions tend to be diverted. And so, and there's even some evidence that people that are receiving treatment for pain, probably the majority of the people for in pain treatment are not the abusers of the opiates. It's really where the prescriptions are going or where they're sold or where relatives are taking prescriptions, getting dependent, and then falling into opiate use problems. So one of the big keys is to safe disposable medications, because it's really the medications that are laying around not being used that are being diverted. And there are many take-back programs that are occurring around the country, and I'll elaborate on a few of those in a few seconds. This is really the key kind of graph here that we're concerned about. You could see the chronically prescribed opiates, the mortality line is flattening out. But what we see down below with heroin and other synthetic opiates, we see that line increasing significantly and not showing any tempering or decrease. So that is really the targeted issue, and kind of what you're seeing as far as the overdose deaths is a move from the prescriptions but to the synthetic opiates. And really the current challenge here is to impact the use of the synthetic opiates, especially carfentanil. Carfentanil is a highly lethal drug. You can see the vials down at the bottom where that 1 little gram of carfentanil can cause a fatal overdose. You can see each vial there just how much you need. Carfentanil is about 10,000 times more potent than morphine. And carfentanil actually was one of the drugs in the Moscow theater deaths that occurred, I think in 2002. It was actually one of the residues that was found on the clothes of the people that died. So it is a highly toxic drug. It's being sold through China and it's being mixed in the street. And the DEA, or the CDC noted the first epidemic a couple years ago where 60 people kind of overdosed within 2 or 3 hours in one city in West Virginia that tapped into carfentanil supply. So this poses risk to funeral directors, and I think this will be talked on later here by some of the other speakers, but the key thing is there have been overdoses in the field with first responders for people responding to carfentanil overdoses. FBI agents have actually gone into an opiate overdose by touching objects in a room that were contaminated with carfentanil. And so this can happen too in preparations of bodies for a funeral. So you should use precautions as are kind of listed here for anyone that has died from an opiate use condition. We also recommend reversal drugs, Narcan, and these drugs can reverse an overdose and work immediately. This is a prescription Evizio, which has it's actually a real neat device. Unfortunately, it's very expensive and very hard to keep in stock, but it walks you through how to use it. It talks to you how to use it, and if somebody is comatose from an opiate overdose, you can give that to them and reverse the overdose on the spot. And this is a nasal inhaler, spray Narcan, which are available through most pharmacies now. But you really need to take training to really learn how to use these. These slides are just really more for information. I'm not really trying to give you direction to how to use this, but these are things you really should look at knowing how to do and knowing how to use, especially when you're around the public and you're around people that kind of are abusing drugs. You can see here that we now have 136,000 organizations as of 2014 providing naloxone to over 150,000 lay people, and there's been reported over 26,000 reversals and saved lives from the use of naloxone. Also, naloxone is now being pushed through pharmacies. CVS, Walgreens are having programs in place to kind of dispense naloxone. I think CVS is rolling out a program next year where they'll dispense without a prescription. Also, they are pushing out medication disposal sites to dispose of unused medications because I know it's problematic sometimes for people to kind of to work on disposing medicines at certain disposal dates. They're trying to have boxes readily available at any time, at any convenience, for people to dispose of opiate medications they're not using. Within the health profession, the Surgeon General in 2016 sent out a letter to all physicians, which has never occurred before, to really tell physicians to get on board, to help treat the opiate epidemic, to also screen for opiate use conditions, and to monitor the use of opiates. The key thing we're seeing in as far as treatment is that we're within Beacon pushing medical evidence-based clinical practice. Unfortunately, within the substance use treatment community, not everybody receives evidence-based care, and that's especially true as far as the use of medication-assisted treatment, whereas right now only about 20% of patients are receiving that, and we see that as really key to long-term abstinence of opiate use conditions, because really these conditions are really considered as a chronic illness where somebody needs treatment over time, like treatment for diabetes, and medication-assisted treatment, number one, can prevent the drug from working if somebody takes an overdose, but it satisfies the cravings and the desire to use the drug so that people can engage in recovery-based treatment. Again, we're not pushing another medication, but we feel this medication is very vital to really engage people in treatment and should be integrated as part of a holistic recovery program. We have also put together a program called Project ECHO to push medication-assisted treatment to providers. This is a collaborative learning environment where we provide psychiatrists through Beacon to kind of, through telehealth and through Zoom technology, to kind of talk with primary care doctors remotely and virtually to kind of educate them how to use medication-assisted treatment, educate them how to refer people for appropriate treatment, and to identify substance use conditions. And finally, EAP is really a gateway, and we really feel it's vital as a resource for prevention. EAP is staffed by behavioral health clinicians, but it's outside of the medical system. There's no chart, there's no copay, but it's designed for any problem that affects someone's life. So typically, if somebody is a spouse dealing with somebody with substance use condition, EAP is a resource to allow people to talk about what's going on, to engage in treatment, and hopefully to engage with appropriate care. It also can be a way to kind of pull out mental health conditions that may need treatment. And it can also provide local resources and places to go to get care. A lot of times with substance use conditions, people don't know where to go, where to turn to, how to get help. EAP is a way to kind of make you aware of what the resources are available to yourself or your employees. Finally, this is a slide here talking about the impact of stigma associated with disease. You know, we really are not using the word an opiate abuser. We're talking about people with a substance use condition. And I think one thing that's really different from what happened in the 20s versus what's happening now is that I think, as was mentioned with the President's Commission, with the push, the task force on opiate use in this country, we're really seeing substance use as a treatable medical condition and not as something that is willful, not as something that incarceration can take care of. So I think going forward, that's sort of the silver lining in all this. I think we're kind of turning a road kind of in how we're looking at opiate use conditions, but substance use in general. So I'm hopeful kind of down the road that once treatment providers, once we get the system kind of going, we'll hopefully stem this epidemic, but really prevent something from happening in the future. Okay, thanks.
Thank you, Dr. Bentsen. And now we have Dr. Perez, who will be sharing his story.
Good afternoon.
Good afternoon.
My name is Phil Pears. I'm also known as Dr. Phil, but for anyone who's confused, I'm not the real Dr. Phil. I have hair. Just want to point that out to everyone. I'm here today to tell you a story. It's a story about my son, Matthew, who died of a heroin overdose on November 14th, 2015, 1 month and a few days away from his golden birthday. It's a story about my daughter, Alexandria, who died from a heroin overdose this past Easter Sunday, April 16th, 2017. Before I begin my presentation, I want to ask you a few questions, and I want you to remember the number 6. How many of you have either had a family member or an extended family member involved with drugs, meaning any kind and all sorts of drugs, cigarettes, alcohol, marijuana, prescription drugs? Almost everyone. How many of you remember 9/11? Of course we all do. How many of you know someone who died or heard about a friend or coworker who died in the 9/11 attack? Almost half. What number did I ask you to remember? Oh, you were such a good audience. We are all 6 people or fewer away from knowing someone who was involved with the 9/11 tragedies. We are all 6 or fewer people away from knowing someone who is involved with drugs. Problem is, no one wants to talk about it. Parents of drug abusers deny it. The kids deny it. Schools look the other way. They don't get involved. Pastors and priests don't engage. We're surrounded by this epidemic right in our own homes and backyards, and no one wants to start the conversation. It's like being a little kid again when we used to play hide and seek. Remember running away to hide, and when the person who was trying to catch you got too close, what did we do? We closed our eyes. Because if we couldn't see them, they couldn't see us. Or maybe I was just a dumb kid. That's another possibility, but I know someone in this audience who won't admit it did the same thing. When a tragedy occurs like 9/11, we can all tell anyone exactly where we were and what we were doing that day. I was driving home from my position in Kenosha as a school principal, and there wasn't a plane in the sky. They'd all been grounded, and I will never forget that silence. I have 2 of my own 9/11 days I'll never forget. Where was I when my son started using drugs? Can't tell you. I don't know. My wife had left me with 2 kids, ages 8 and 11, after 17 years of marriage. She left everything, and suddenly I was a single parent. Life became a struggle as a mom-dad. Took the kids to school every day, neighbor picked them up. Sometimes between the divorce and his early teens, Matthew started using. As a sophomore in high school, he stopped participating in sports, football, wrestling, martial arts. Started hanging out with what I thought were pretty decent kids. Little did I know they were all smoking and drinking. In his junior year, he started missing school. His grades dropped, and as a senior, he ultimately dropped out of school. I took him to counseling, talked to school staff, to professional friends I had known for years. He was arrested and incarcerated, and I thought, now, finally, this is the end of it. Unfortunately, it got worse. Matthew started stealing from me money, my car, anything he could get his hands on to raise some cash, all the while getting deeper and deeper into the world of illicit drugs. Because there are laws, at least in Wisconsin, protecting teenagers from being committed to rehabilitation centers once they turned 14, I couldn't get him into treatment. After serving his last day in another jail for another theft and possession of drugs, he finally agreed to go to a treatment center as a condition of his release. My ex-wife and I put him on a plane to Texas for admission to a rehab center. Hallelujah. My son was going to treatment, would be treated successfully, and would come back as the Matthew I knew. Precocious, inquisitive, outgoing, friends with all, altar boy in my church, Boy Scout, athlete, kid that liked to go fishing with me and catch muskies when we could, snowboard instructor. All that changed to becoming a convicted felon, drug seller and user, thief, manipulator. He returned to Milwaukee against my strong advice. I really wanted him to stay in Texas. He learned to ride and train horses and was the son that had left me to enter another world. But he came back. In a few short months, he was back with his old buddies, and soon he was immersed in his old routines, stealing, dealing, using, going to jail. Plan B, leave Milwaukee, go to Colorado. Another rehab facility in Milwaukee, and off to Colorado he went. He started his own business, seemed to be thriving, really thriving. And within a year, he was back in jail again. One of Matthew's buddies decided to bail him out. Upon his release, he went out with his friend. He overdosed, and he died. I got the call on my way home from work at 5:15 in the evening. My son had overdosed and was gone. And that's the day my time stood still. My daughter, Alexandria, was a slightly different story. After the divorce, she asked if she could live with her mom in Madison. I had full custody, but it was her mother, and it really seemed like the right thing to do. Sometime over the next 4 years, she started using. She finished high school, started college at age 17. Extremely precocious, intelligent, planned to become a veterinarian and a therapist, combining her love for horses with a therapeutic ranch. I even bought her a horse. She named him Ditto. Don't ask me why. Cheerleader, honor student, model, talented artist. Loved the outdoors, loved to go fishing with me and her brother. Strong-willed, in charge, outgoing, involved with illicit drugs, and just like her brother, she morphed all the way to jail and rehabilitation. She went through the routine twice, got pregnant while using, and gave birth to 2 boys, Aiden and Elliot. Both were born prematurely and spent the first 4 months in a neonatal intensive care unit. Aiden, unfortunately, didn't make it. Elliot survived, born with cerebral palsy and other serious neurological issues. He is now 3, almost 4 years old, and he's living with her boyfriend's mother, Kathy, at her family. He has a regime of doctor's appointments, daycare, and therapy. He is in a home where he is loved beyond words. Kathy told me at Allie's funeral, when she put him to bed on Saturday night, he told her, "Mommy came to play with me." Sunday morning, the morning Allie passed away, he woke up and said, "Mommy came to say goodbye." Allie's death was being investigated as a possible homicide. The detective met with me and said the syringe she had been using was still almost full, and she died before she hit the floor. They suspected fentanyl or carfentanil. However, they determined there was another drug in her system, the motragine, which is an apparent seizure medication, and the 2 of them are a lethal combination. She met with me the Wednesday before she overdosed, full of life and good spirits. She just bought a new pair of cowboy boots so she could start her job, working with horses on a therapy ranch. She was going to come over for Easter for the first time in years. And why she relapsed, I'll never know. I learned that addicts tend to reuse drugs at the same level of their addiction when they again have access to them. Because they've been completely detoxed, their system cannot tolerate the injection at the same levels they were used to. And with the introduction of new drugs like fentanyl and carfentanil, which were mentioned, which is 800 or more times stronger than an elephant tranquilizer, these kids don't have a chance. Although paramedics were called for both of the kids, it was too late. Their lives are over. The small white box that I received, and you're all familiar with them for cremation boxes, I'm sure, had my sons and daughters' ashes after they passed, and they both wanted to be cremated and thrown to the wind to be free. And they both got their wish. I don't have any more answers today than I did a few years ago. I have questions, many questions. I do know, since I got involved with the Walker County Heroin Task Force, that good people, very, very good people, are dedicating their time, their talent, and their resources to combat this epidemic. I know kids die every day, hundreds of kids, diseases, accidents, serving the military, random acts of violence, you name it. I know in my heart the finality of burying a loved one, especially your own child. And I am forever grateful to all of you, the professionals in the funeral industry, who allowed my beloved children to celebrate their lives with dignity. My faith is the one thing that has kept me strong, and for that I am eternally grateful. If you don't know someone who lost a child before this presentation, now you do, and you are no longer 6 or more people away from knowing someone who was affected by this epidemic. If you believe this problem is going to go away on its own, it won't. If you think this can't happen to you or to someone you know, you're wrong. If you really believe this is someone else's problem, it's not. If you do nothing else at all, please start the conversation. Addiction is not a closet disease. We're not living in the 1800s when our aunts or uncles or some relatives drank too much or were mentally disabled and no one talked about them. They were our family secrets. Shh. This is 2017. In today's world, some little 5-year-old kid who lives in another country can play the hell out of a set of drums, get millions of hits on YouTube, is flown to the United States and becomes an instant celebrity on the Steve Harvey Little Big Shot show at age 5. It's a whole new world out there for the communications and the celebration, certainly. I'm 72 years old, and my only claim to fame is I was born on February 22nd, which is George Washington's birthday. And, if that's not enough, my lineage goes back to Alfred the Great, who cut off anyone's head who opposed him. Not much to brag about there. So, how do you start the conversation? Well, you certainly are here getting information. The task force is using the 211 exchange in Wisconsin to provide resources for anybody who's interested. Internet, paper, CDC has declared this a national epidemic, and now the president has joined in. I want to start the conversation with your significant others, your kids, your church, your PTO. I was absolutely amazed, not by the outpouring of condolences I received at my children's wakes from family members and close friends, but from the condolences of another circle of acquaintances, people I knew from work, people I had met casually, who wanted to share their stories, personal stories about their own sons or daughters, or their extended family members. I had absolutely no idea their lives had also been turned upside down by their own personal tragedies. When I read about the task force that our state attorney general, Brad Schimmel, started, declaring war against drugs, I sent him a personal letter, handwritten, asked him about the group. He sent a personal letter back, encouraging me to get involved, and of course I did. If I can do anything within my power to help save one life, I will consider my time well spent. If I do nothing at all, then I too am part of the problem. So I implore all of you, be a hero. Start the conversation. You really never know whose life you may save. Thank you all for your attention.
Thank you, Dr. Perez. Now we have Keith Walker from Walker Funeral Home. He's got some great programs that he's helping put out in Ohio. I think you guys will appreciate.
I just need to find out where the slide part is, because that is a big part of it. Great, thank you. Just go forward that way. Okay, great. Thank you. As Charles said, I'm Keith Walker, and I'm with Walker Funeral Homes in Toledo, Ohio, and Northwest Ohio. And we serve in our communities, both rural and urban areas, so we've been able to see this issue from a couple different perspectives. But what it all comes down to is exactly what the doctor's talking about. And we've heard, I think it's about 100 people a day are dying from this. They're mostly younger. There's stories like his that are happening all the time. And we, as funeral directors, are in a pretty unique position to see the after effects of this horrible tragedy that's affecting our country. Back in 2015, we saw a huge increase in the number, probably like all of you did, in the number of heroin overdoses and opioid problems coming through our funeral homes. We got to talking about, is there something that we can do? What you also notice a lot of times in these deaths is the shame, the sort of not wanting to talk about it, the stigma that's attached to it. And we thought if we could raise awareness in the communities and get people talking about it, hopefully reaching out for help before it gets to that point, then we would have served the community well. And what I'm here today to do is to share with you what we did, to give you some ideas of how you might be able to take that back to your communities and maybe make a difference in this epidemic for the good, to try to save at least one life or make some kind of a difference. So we came together and began a conversation with a lot of the other players in Northwest Ohio, and ended up forming a partnership which has been pretty effective of at least starting the conversation and giving people resources that they can reach out to get help. We came together with, these organizations will probably mean nothing to you, but I'll kind of go through them quickly to let you know who they are and what they do, and I'm sure in each community there's something similar to them. But the Zeph Center is a mental health and recovery organization. DART is unique. It's Lucas County is our county that some of our funeral homes are in, and the Sheriff's Department determined that incarcerating people from heroin and other opiate problems is not a solution. So they worked very hard to get the addicts into treatment and to try to get them on the road to recovery. They've been a huge part of this effort. Team Recovery is a group of recovering heroin addicts that come together to support each other. What you heard earlier is that a lot of times when people are in addiction, their entire friend network is composed of that. So once they get clean, they go back to their old friends, and it's right back to the same old thing. These guys have come together and support each other and formed a bond that's really helped a lot of them stay sober and stay off the drugs. Rooted Mind is another recovery agency. So those are the agencies that joined with us. Then we also had our local ABC television station, our billboard company, and the biggest radio station in our market, as well as some of the newspapers, and some others come together. So with that, I'll kind of explain how each one of those came into this and what we did. We started with a multimedia campaign back in 2016. And the most effective thing we started with were these big billboards. A lot of them were electronic. And it was pretty much alerting the community that there is a problem, and then also starting to let the people that are involved in the problem know that there are resources for help. So at this time, we put a website of one of the agencies up there and had quite a few billboards around town. Another example of it. Then in 2017, we thought we need to get into the younger ages. So we got the junior high schools together and had a contest where the students in the art departments designed our new campaign. And we had 5 winners, gave cash prizes for them, and then those became the billboards for 2017. That's an example of one of them. Another, and now you can see I'll get at the website in a minute, but we have the website on there as well as the phone number that they can call for help. We also had a print campaign that went with it. then also a contest for those. What we found, though, in 2016 when we started this, the appreciation of the community was tremendous, and people were calling our funeral homes asking for help, and we didn't know what to do. So we would then put them out somewhere else. We'd have people calling for themselves saying, I need help right now, what can you do for me? So what we did is we put a website together and put that there out, and we advertise that now. And that has links to each of the agencies that can help people, then get help immediately if they're ready to make a change, or that someone in the family is having a problem. Now to kind of review what we did with that, the cost of it, and what's happened. The immediate result was a lot of engagements where I would go out and speak to groups with a panel similar to this. And that was difficult for me because I really have no experience with this. So I had to learn about it as much as I could so I knew what I was talking about when I got out to the communities. The website was fantastic help, we think. And in the partnership, for every ad we purchased from our funeral home, they would match with either a billboard or an ad or something like that. So over the course of 2 years, we've probably invested about $100,000 into this, but we've had a $600,000 impact on the market. And we can definitely see much more awareness, much more discussion of it on the TVs and in the media and the radio, and a lot of public speaking. One of the most rewarding talks that I was able to give was to the Dental Society of Toledo. And the purpose of their campaign or their talk that night was to educate dentists as to what to prescribe that's not opiate-based and how to do that. And that has made a big difference, too, in getting less people started on that route. Because we see a lot of people start with a prescription, maybe, and then can't afford it or get addicted to it and then move to heroin, and then it's a big problem. So I'm available if anybody has any interest in getting started with this kind of a thing afterwards to talk to you. But we think we're making a difference, and we hope that we're going to help some people with it. So thank you.
Thanks, Keith. Again, my name is Charles Castiglia. I'm the president of Lakeside Memorial Funeral Home in Hamburg, New York, which is just outside of Buffalo, New York. Also, I am the current president of the International Order of the Golden Rule. And the Order of the Golden Rule has, if you've grabbed one of the booklets out front, you'll see the Order of the Golden Rule created that booklet on how funeral directors can respond. And this all starts out of our own stories. Each one of you here today has some story of your lives or maybe the impact of this drug. My story started a little bit ago, but before I get into my story, I want to ask you a few questions. How many of you have handled an overdose death in your funeral home? Quite a few. How many handled them 5 years ago? That's the most I've seen at any of the presentations I've done. How many have never had one? Never had one. For me, this started about 2 years ago. I hardly ever handled an overdose funeral before that. We're in a suburban community outside of Buffalo. Never really any problems. I might have had a drug-related death, but never an overdose. And that changed for me on Thanksgiving Day. I was sitting with my family, celebrating the holiday, having dinner, sharing stories, catching up on the things that everybody's been doing because we were all together for Thanksgiving. And like many of us as funeral directors, you get that call. But this one was a little more heart-wrenching for me because it was my brother's best friend. My brother stood up he stood up at my brother's wedding. My brother was his best man, and he had just lost his son. They were trying to get him help. They had convinced him that he needed to go into drug rehab, and he was going to go the day after Thanksgiving. He was going to have one more holiday with his family. And while his mother was preparing dinner, getting everything ready, he went into his room, said, I'm going to go take a nap. And then when they went to go find him, to wake him up, to come have dinner and share with everybody, they found him dead in his room. The funeral was very intense. The crowds were packed. We had a line through the building, around the door. He was a young man, only in his early 20s, and those young men still have a lot of friends. They're still connected with their friends from high school, and then all the friends of the parents were there. The kids were active in hockey, and they were active in all kinds of sports, and so all these people showed up at the funeral home. And we had a lot of people. We had to have people in the parking lot. We had to have extra staff on hand. And we had one other interesting thing. The police were in plain clothes, and the drug dealer who sold them the drugs attended the funeral, and they arrested him out of the line. Then again, on Easter in 2016, a really good friend of my son and my nephew's passed away, similar situation. They were trying to get him into help. He wanted to have one more last holiday with his family. They went in his room, and they found him dead. Again, large crowds, tons of people, 1,000 of people at least, come through the funeral home. And then we had an incident. There were a lot of young men and some women that were attending the funeral who were also on some form of the opioid. And one kid walked up to the casket after he expressed his condolences to his mother, and it appeared that he headbutted the body in the casket. I learned now that that's not quite what happened. It's called the heroin nod. They lose balance kind of from the waist up. They don't collapse their legs, but they kind of fall forward. And he went into the casket. It wasn't intentional, but at first, at the time, I was just mad that he headbutted the deceased, and it was something else. It was the heroin nod. So the mother quickly ran up to him, grabbed him by the arm, walked him out to the hallway, and then her brother escorted the young man out of the funeral home. He went to his car with his girlfriend. He shot up again, and he overdosed in my parking lot. Thankfully, I had a lot of staff on hand because we knew it was going to be large crowds. One of my attendants was out in the parking lot who happened to be fire chief of the local fire company, and he immediately called 911. And the police arrived, gave him the first administration of Narcan, had to do a second one because one dose nowadays with the intensity of the drugs that are out there don't necessarily do it in the first shot anymore. They got him better. And then he refused to go in for treatment, and they had no choice but to send him home. That led to a news story. The Buffalo News contacted me. They asked me, what happened, how it happened. They had heard about it. And I got the mother of the deceased young man to come, and we interviewed with the paper, and we told them what happened, and we discussed the tragedies that are associated with these losses and how it's affecting families, good families. And they put it on the front page of the paper. And they put it on their website. And that's when all hell broke loose. There was a tremendous backlash. People attacked the kid that died, saying he was a junkie, that he was no good, he deserved to die. Wasn't true. He was a good kid. They attacked the family. They said they weren't good parents, that there must have been some family problem that caused him to go to drugs. That couldn't be further from the truth. These families that I'm serving are people I've known my whole lives. They're my friends. I've known them since I was a kid, and they've lost their children, and it's heartbreaking. They attacked me. Said, the funeral director, he laughed all the way to the bank. He wasn't that heartbroken that that child died. A lot of times, these kids don't have the money for the funerals. The parents aren't expecting it, and we have to help out. One thing I want to commend the Buffalo News for is they took the comments down and they blocked any more comments on that article. We went from 0 overdoses to averaging 1 a month, 2015 to 2016, to now we're averaging 1 to 2 a week. In June, we had 5 overdoses and 3 suicides. We're also seeing a spike in suicides. Probably related. I don't know for a fact, that's anecdotal, but we're seeing both those things climb. We're losing a generation of young people. That article and that story led me to start trying to create more community outreach. I then joined the Erie County Opiate Task Force, and I had all of my staff trained for Narcan. The grief that these families are going through is not like anything I've ever seen. I guess maybe it's similar to suicides because they feel like maybe they could have done something else. One mom said to me that she feels she no longer has an anchor in this world, that she no longer feels connected since she's lost her son. But I think in many ways this is worse. A lot of times parents are told, oh, you got to have tough love, you got to, throw them out of the house. And then they have that guilt that because they did throw them out of the house or they didn't help them, that they lost that child anyway. And that no matter how hard they tried, no matter what they did, if they had Narcan training and they had it in the house and they were prepared for this to happen, they still couldn't save their children. There's not enough programs available. There's not enough beds. And in most cases, the programs that are out there are not the right programs. 30 days is not enough in a detox. You can physically detox, but these kids have chemical changes in their brain that are permanent from taking opioids. It takes much more intensive support. It takes medical treatment to go in hand with it. I've seen kids survive. I've seen kids turn their lives around with the help of some drugs so that they can at least function, taking Suboxone or methadone. But as a funeral director, what should you expect? Well, the first thing, expect those large crowds. They're going to be there. These are young people. Expect police involvement. You may have an arrest, like I did, right out of the line of the procession. Or you may be contacted by the police so that they can come in and try to take the fingerprint off the phone so that they can open up the deceased phone so they can try to maybe track the dealers. Expect theft in the funeral home. Their friends are also doing the drugs. There was a girl that used to work for me as a funeral director. She was a great kid, and she was a heavier girl and did a gastric bypass system. I didn't talk about this last time, but this is something I just found out about. She had a gastric bypass, and she lost like 100 pounds, and all of a sudden she was getting all kinds of attention, and she left the funeral business, and she started drinking a lot, and quickly, because of the bypass inability for her body to absorb alcohol the way we normally do, she became an alcoholic. She then hurt her back, started doing prescriptions, and that progressed quite quickly for her to the point when she was no longer able to get prescriptions and she was doing heroin. She was averaging $200 a day. She was stealing. She was doing other things. And I really like this kid. She's doing well right now. She's on a Suboxone treatment plan, and she's been good for the last 18 months, but I pray for her every day, because I don't know when things will slip. We have had somebody come into our funeral home and steal things out of our office to try to sell them to feed that $200 a day habit. And the grief on this level is just so intense. As you heard Dr. Phil, you can't help but be moved by his story at the level of the hurt and the pain. Some parents that I've dealt with are so grief-stricken that, unlike Dr. Phil, who's trying to make a difference, they can't function. There's one mother that I know who just won't talk to anybody, won't leave her house, and it was her son that was on Thanksgiving in 2015, and it's 2 years later. There's also the emotional toll on the funeral directors. After June, when I had those 5 calls, I had one of the young funeral directors working for me decide that she no longer can do this. She's now a photographer's assistant, doing something more cheerful, celebrating people's celebrations. It was too much for her to go through this. After that month, when I was sitting in my car after the 7th funeral, I pulled into my driveway at home, sat in my car, and cried. I couldn't take anymore. And I didn't want to bring it into the house to my wife. I'm burying my friend's children. We're all doing that. We need emotional help and support too. The funeral directors also need counseling as well, because we're going through such a terrible time ourselves. So, there's also a physical threat. We know how powerful these drugs are. A few weeks ago, I did a presentation in South Carolina at their fall forum, and they were telling me, they were showing me news articles that they're calling it the gray death. There have been more deaths now by overdose in the state of South Carolina than homicide. You heard the story about the police officer in Ohio who was on a scene. He had gloves on. He had a face mask. After the scene, took everything off. One of his fellow officers says, "Hey, you got a speck of white dust on your shirt." He brushed it off. The carfentanil was so strong that just through absorbing it through his skin, he overdosed and died. So as funeral directors, we have to take precautions. Now, there hasn't been an incident of a funeral director doing that, but I'd rather be safe than sorry. So I strongly suggest the use of nitrile gloves. Latex gloves are porous, and the powder could penetrate through. Nitrile gloves are not porous. But as funeral directors, we know that some of the chemicals we use may eat through the nitrile gloves, so my suggestion would be to put nitrile gloves on, and if you're using those other chemicals, like drying, glutaraldehyde based, they'll eat through the latex. Put the latex on top over the, they'll eat through nitrile, not latex. Put the latex gloves on over the nitrile gloves, so that way you're double protected. Always wear a face mask. Wash off the body immediately upon entering into the care center, so that hopefully you wash off any residue that may be on them. Use universal precautions. I know we talk about it, and I have to argue with some of my funeral directors all the time, like, I don't need to. No, you have to, every single time. These drugs are so strong, they don't have to inject it anymore. They can snort it, they can put it in, they don't have to inject it like they used to. So I'm also advising the families, especially because their kids are dying in their bedrooms, that they need to take precautions when they clean out the room. They don't know what's in there. And so I advise them to wear a mask, and I advise them to wear long sleeves, and I advise them to wear nitrile gloves. I haven't seen it happen, but better to be safe than sorry, better to be prepared. So my work with OGR has then created the book you guys received, The Opioid Epidemic and How Funeral Directors Can Respond. I'm impressed to say we've actually sold over 20,000 copies of this since our presentation in July, which is impressive. And OGR wanted to take a step forward further, and we created a second book which just was printed. And this one is designed for you to take out into the public. It's called The Opioid Epidemic, How Communities Can Respond. And this book is available for you if you want to do presentations in your communities. I've been speaking at local churches, I've been speaking at community groups, I've been trying to bring awareness because I don't think people understand how serious this issue is necessarily, although it's starting to get that recognition, and I don't think that people understand a lot about the disease. And I think they don't understand a lot about the people that are using them. They think it's somewhere else. They think it's not my backyard. They don't think it's, oh, this must be an inner city problem, but it's not. It's a problem that affects all of us. The other thing I'm trying to convince people is to start disposing of their prescriptions. If you're done taking them, don't leave them in the house. Our police departments have set up disposal units at every one of their police department locations. And if your police departments aren't doing that, work with them. Convince them that this is necessary and have them handle the destruction of the drugs. Don't flush them down the toilet. In Lake Erie, one of the major Great Lakes, there are traceable amounts of antidepressants in the water just because people have been flushing their antidepressants down the toilet. So these are drugs that are so powerful and so deadly, you don't want to be flushing them. One of the fastest growing areas where addiction is starting to climb a little bit is going to be affecting us as well, senior citizens. So this is a different type of a drug addiction. It has the physical and it has the psychological addiction that most addictions deal with, but the fact that there's the chemistry changes in the brain make it very difficult. And a lot of people need to understand that. So we've made the effort to not only train our staff, but our community about this deadly disease and its dangers. And I encourage each one of you to do the same thing, because if we all become a part of the solution, if we're not all a part of the problem, but we all can be a part of the solution. Thank you.